Hey there. Ready to dive into, well, the entire history of healthcare. We're talking all the way from, the very beginning to the mind-boggling complexities of medicine today.
It's quite a journey, right?
No kidding. So we're starting with, get this, hunter-gatherers.
They were the original trailblazers, using natural remedies, experimenting with plants and minerals to heal what ailed them.
It's like they were the original biohackers.
In a way, yeah. And we can't forget about the shamans, the healers of their time, using rituals, herbs, their knowledge of the natural world to try to mend the sick.
Right, because back then it wasn't just about, popping a pill. It was all connected to spirituality, right?
Absolutely. Healing the body and the soul, restoring balance, it was all intertwined. And you see this throughout history, this connection between spirituality and medicine. But let's jump ahead, shall we, to ancient Egypt, around 1550 BC.
Ooh, ancient Egypt,
Mm.
pyramids, pharaohs, all that jazz.
Exactly. But they were light years ahead in medicine, too. They had this thing called the Ebers Papyrus, basically an ancient medical textbook outlining treatments for everything from wounds to, get this, digestive issues.
No way. So they were worried about their gut health even back then.
It seems like it.
Mhm.
And get this, the Ebers Papyrus even mentions using honey and mold to treat infections.
Honey and mold, that sounds more like something you'd find in, a forgotten corner of my kitchen.
Well, you might be surprised. It's a surprisingly advanced concept, even for today.
Wow. You're blowing my mind here. But I have a feeling this is where we start to see a bit of a recurring theme in healthcare history.
And what's that?
Well, all this incredible knowledge, it wasn't exactly accessible to everyone, was it?
Sadly, you're right. As advanced as the Egyptians were, this high-quality care was often reserved for the elite, the pharaohs, the wealthy.
It's like the OG version of a healthcare gap.
Exactly. And unfortunately, it's a pattern that we see again and again throughout history.
That's something to think about. Okay, so we've got spirituality and medicine all mixed up, some seriously advanced practices in ancient Egypt, but also this problem of limited access for most people. What's next on our whirlwind healthcare history tour?
Well, let's head over to ancient Greece, where we meet a guy named Hippocrates.
Wait, Hippocrates, like the Hippocratic Oath, the do no harm thing?
That's the one.
Mhm.
And let me tell you, this guy was a total revolutionary. He basically flipped the script on how people viewed illness.
Oh, how so?
Well, back then, people thought illness was like a punishment from the gods, right?
Makes sense for the time.
Yeah. But Hippocrates, he challenged that. He said, no, no, no. Illness is not some divine retribution. It's caused by natural imbalances in the body.
So he was like, it's not the gods, it's your diet.
Basically, it was a radical shift in thinking from supernatural to natural causes. And it's hard to overstate how groundbreaking this was. It really paved the way for how we think about medicine today.
You're telling me, focusing on what's actually happening in the body instead of blaming it on Zeus or whoever?
Exactly. Observation, taking a patient's history, understanding their symptoms. These were all practices that Hippocrates emphasized, stuff that's still absolutely essential to how doctors practice medicine today.
It's wild how these ancient ideas still hold up. Okay, so we've gone from shamans to ancient Egyptian papyri to the groundbreaking ideas of Hippocrates. Where do we go from here?
Well, next, we're heading to Rome. Now, the Romans, they were known for their practicality, and that definitely extended to healthcare. Public health was kind of their thing.
Public health? What do you mean?
Well, think about it. Aqueducts to bring in clean water, sewers to manage waste.
Yeah.
They even had public baths.
Wait, public baths in ancient Rome? Like everyone in the same tub?
Not exactly. But yeah, they had these elaborate bathhouses, and it wasn't just about getting squeaky clean. It was about hygiene, preventing disease.
Hey.
They were way ahead of the curve when it came to that stuff.
Wow, talk about being ahead of their time. So while other civilizations were still struggling with basic sanitation, the Romans were building bathhouses. That's incredible. But what about Roman physicians? Do they have any tricks up their togas?
Oh, absolutely. One name that stands out is Galen.
Galen. Okay. Tell me more.
Well, he was this prominent Roman physician, made huge strides in surgery and anatomy,
Yeah.
even challenged some of Hippocrates' ideas. He was a big believer in getting hands-on,
Hands-on how?
dissections. He was all about dissecting, not just animals, humans too, to really understand how the body worked. Pretty controversial back then, but he made some major discoveries.
Wow, talk about pushing boundaries. He sounds like a total rock star. But given what we've seen so far, I have to ask, did everyone in Roman times benefit from Galen's expertise?
That's the million-dollar question, isn't it? And sadly, the answer is not quite.
Here we go again.
Yeah. Despite all the advancements, all the progress, the Roman Empire, with all its might, still couldn't quite crack the code on equal access to healthcare.
So even with public baths and groundbreaking surgeons, the same problem persists.
Sadly, yes. The poor, the marginalized, they often missed out on the best care that Rome had to offer. It highlights this frustrating truth that even with incredible innovation, there are still these deep-seated challenges when it comes to making sure everyone benefits.
Yeah.
And it's funny how, sometimes things have to take a step back before they can really leap forward.
What do you mean?
Well, think about it. After the Roman Empire fell, Europe kind of went into this period we call the Middle Ages, right?
Right.
And, well, medical knowledge, at least in some places, didn't exactly keep up with those Roman bathhouses we were talking about.
Right. It's like this constant ebb and flow, right?
Yeah.
Periods of incredible progress and then kind of a stall. So was it a total blackout of medical knowledge in Europe during the Middle Ages? Were they back to square one?
Not exactly a total blackout. Western Europe definitely hit a bit of a slowdown, but it's super important to remember that the rest of the world wasn't exactly sitting around twiddling their thumbs.
Oh, right. Like, what about the Islamic Golden Age? Wasn't that happening around the same time?
You got it. While Europe was, let's just say, preoccupied with other things, scholars in the Islamic world were busy preserving and actually expanding on all that amazing knowledge from the Greeks and Romans. They made some huge strides in medicine, surgery, pharmacology. I mean, you name it.
So they were like the keepers of the medical flame while other parts of the world were, well, in the dark. That's incredible. Who are some of the big names from that era?
Well, one of the absolute giants was this physician and philosopher named Avicenna. Ever heard of him?
Avicenna rings a bell, but I can't place it.
Well, he wrote this book, and this was called The Canon of Medicine, that basically became like the ultimate medical textbook for centuries.
Yeah.
Imagine Gray's Anatomy, but way, way, way older.
Whoa, that's amazing. So even when some parts of the world were facing setbacks, others were pushing the boundaries of what was possible. It's like knowledge finds a way, you know?
You said it. It's all interconnected, right? Ideas travel, they take root in unexpected places.
Yeah.
It's pretty amazing when you think about it.
Totally. Okay, so we've gone from ancient shamans to Egyptian papyri to the brilliance of Hippocrates, the practicality of the Romans, and the Islamic Golden Age keeping knowledge alive. What happens next in our healthcare saga?
Okay, so buckle up, because next we're heading to the Renaissance.
The Renaissance, Da Vinci, Michelangelo, all that.
Yeah, all that. But the Renaissance was about way more than just art. It was like this incredible period of rediscovering ancient knowledge, challenging old assumptions, and one guy who really embodied that spirit was Andreas Vesalius.
Okay, Vesalius, I feel like I should know that name. Refresh my memory.
Anatomy. This guy was obsessed with the human body, but he wasn't content with just reading about it in old books. He wanted to see for himself. So he started doing dissections, tons of them, making these super detailed observations, and guess what? He ended up correcting some pretty big misconceptions that had been passed down for, centuries.
Whoa, so he was like, forget what the textbooks say. I'm going to figure this out myself. That's got to be pretty controversial back then, right? Challenging the established knowledge.
Oh, yeah, for sure. It was totally shaking things up. But his work, this is especially his book, De Humani Corporis Fabrica, which, by the way, was full of these incredibly detailed anatomical drawings. It totally revolutionized how we understand the human body.
It's like he gave us a whole new way of looking at ourselves, literally from the inside out. Were there any other big breakthroughs during the Renaissance? I feel like things are really starting to heat up in the world of medicine.
You are so right. And speaking of seeing things in a new light, this is when this Dutch scientist named Anthony van Leeuwenhoek comes in and changes everything.
Leeuwenhoek, okay.
Yeah.
That's a mouthful. What did he do?
Well, only invent the microscope.
Wait, seriously, the microscope, that's like huge. Talk about a game changer. I mean, think about all the stuff we wouldn't even know about without microscopes.
You're telling me. It was a total revolution. Suddenly, we could see this whole hidden world of microorganisms, bacteria, viruses, cells, stuff that nobody even knew existed before.
It's like discovering a whole new universe, but like on a tiny scale.
Right. And with that discovery came a whole new way of thinking about disease.
Because before microscopes, they had no idea what caused diseases.
Right, exactly. People were basically fumbling in the dark.
Yeah.
But with Leeuwenhoek's discovery, boom, it led to what we now call germ theory, which was like this massive paradigm shift.
Okay, so we've got anatomy getting a major upgrade, the microscope blowing everyone's minds, a whole new understanding of what causes disease. This is starting to sound a lot more like the medicine we know today, but I know you. There's always a but, right?
You only too well, because as amazing as the Renaissance was for pushing medical boundaries, that same old issue keeps popping up.
Don't tell me. Not the healthcare gap again.
Yep. Sadly, even with all this incredible progress, the poor, the marginalized, they still often missed out. It's
Yeah.
frustrating, right?
Totally frustrating. It's like, why is this so hard to
Right.
fix?
That's the million-dollar question, isn't it? It's like this pattern that repeats throughout history, even when we make these huge leaps forward. And then we hit the 20th century, and bam! It's like healthcare goes into overdrive.
Overdrive, huh?
Yeah.
Like warp speed ahead on medical advancement.
Totally. We're talking game-changing discoveries, life-altering breakthroughs. It's a wild ride.
Okay, so hit me with it. What were the big ones? The ones that completely transformed the landscape of healthcare?
Well, first up, you got to hand it to antibiotics. Penicillin, for example. Total game changer. Infections that used to be a death sentence. Treatable.
Right, because before antibiotics, even a simple cut could get infected and, like, become life-threatening.
Exactly. It's easy to forget how revolutionary that was. And then on top of that, we've got the rise of medical imaging. X-rays, ultrasounds, MRIs. Can you imagine a world before we could see inside the human body without actually cutting it open?
Talk about a game changer. It's like going from using a blurry old map to having, like, Google Earth for your insides. You can pinpoint exactly what's going on. And what about vaccines? That was huge in the 20th century, right?
Absolutely. Vaccines were huge. Polio, measles, mumps, rubella.
Right.
These were diseases that terrified parents, and for good reason. They could be devastating. But then along come vaccines, and it's like this incredible shield of protection.
It's amazing how vaccines not only protect individuals, but also have this ripple effect on public health, right? Like, the more people who are vaccinated, the harder it is for those diseases to spread in the first place.
Totally. It's like this incredible example of how individual health and public health are intertwined, you know.
Right.
But, and you knew there was going to be a but, didn't you?
Okay, spill the tea. What's the catch?
Well, as amazing as all these advancements were, the 20th century also brought with it some pretty thorny ethical dilemmas.
Oh, yeah. Like what?
Well, think about it. The pharmaceutical industry explodes during this time. We're developing these life-saving drugs, but then the question becomes, how do we make sure everyone who needs them can actually get them?
Yeah.
How do we balance innovation with affordability and access?
It's like that same tension we keep seeing throughout history, right? We make these huge leaps forward, but those benefits don't always reach everyone equally.
You got it.
Yeah.
And sadly, that theme of unequal access to healthcare, it continues to cast a shadow over the 20th century. Disparities based on race, gender, socioeconomic status, these issues, they persisted.
And then, of course, the COVID-19 pandemic comes along, and it's like someone hit the fast forward button on all the challenges we've been talking about.
Totally. The pandemic, it really exposed just how fragile our healthcare systems can be and how deeply those vulnerabilities are intertwined with all these existing social and economic disparities.
It's a lot to process. After this whirlwind tour through healthcare history, I'm left wondering, like, where do we even go from here? What are the big takeaways we should be carrying with us?
That's the million-dollar question, right? But I think if there's one thing I hope people take away from all of this, it's that healthcare isn't just about science. It's not just about technology. It's about people. It's about understanding the social, the economic, even the political forces that shape how we access care and how those forces have played out over centuries.
So it's not enough to just keep searching for the next cure, the next breakthrough. We also have to be thinking about how to make sure those discoveries actually reach everyone who needs them.
Exactly.
Yeah.
And that requires us all to be engaged, to ask tough questions, to demand better from our healthcare systems. Because the story of healthcare, it's not over. It's still being written.
That's a powerful thought. And it actually makes me feel kind of hopeful. We've covered a lot of ground in this deep dive, from ancient shamans to high-tech hospitals. We've seen it all. And yeah, there have been setbacks, there have been challenges, and there still are. But if there's one thing we've learned from exploring healthcare through the ages, it's that humans never stop striving for a healthier future.
To a healthier future.
Cheers to that. And to all of you listening, thank you for coming along on this journey with us. Keep those questions coming, stay curious, and let's all keep working towards a world where everyone, everywhere, has the opportunity to live a long, healthy life. Until next time, stay curious, friends.